Well, hi, everybody. Welcome to our Tuesday evening call where we introduce a little bit about the history of LifeWave. We talk about the technology. We share some wisdom and background of our CEO, founder, and inventor scientist, David Schmidt. And then we bring on one of our special guests. This evening, we have Dr. Stuart Freedenfeld. So then it's your turn. We open things up for you to share your stories, to ask questions, and just a little reminder, symptoms only to stay compliant. We really appreciate that. And if you have a story, what it was like before, the limitations you had, which patch you used, and then what you're able to do now. And if you're new this evening, a special warm welcome to you. This is a great place to come to get introduced to a very special company. So I'm going to turn things over to my partner, Gregory Muscari, and he's going to do a short presentation on the company and the technology. Over to you, Gregory.
Beautiful. Thanks, Robin. Good evening, everyone, and welcome to our X39 stem cell activation webinar. And I'm going to go ahead and share my screen. And before we get started, I want to actually share a personal realization I came to. I finally figured out what I want to be when I get older, younger. And I don't know if any of you can relate to that, but I'd like to ask you a personal question. If anything were possible, if you could take out a magic wand and anything were possible, what is one thing you would choose to experience differently in your health? Think about that. What is one thing you would choose to experience differently in your health? And what difference would that make to you? Now, I do want to make it clear that our products are not designed or intended to heal, treat, diagnose any disease. They do, however, help our bodies to get back into a more healthy, regenerative mode. And many times, wonderful things begin to happen. So think about that. What is one thing you would choose to experience differently in your health? And let's talk about the stem cell revolution, because certainly everyone wants to look, feel, perform, and live younger. And stem cells are the key because they're a vital part of our immune system that actually repairs and regenerates all the damaged cells in our body, in our bones, in our organs, glands, muscles, brain, heart, lungs, you name it, everywhere. The problem is, and the sad truth is, the older we get, the fewer stem cells we have. And by age 60, only a small percentage actually remain. And the fewer stem cells we have, the faster we age, the slower we heal. And it's like, we're heading downhill and we're picking up speed. And the end may not be pretty if you're not careful. So what about stem cell injections? They're very popular and very expensive. They can be painful, risky, controversial. And there's no guaranteed results. You could spend thousands of dollars with mediocre, minor, and maybe no results. Well, we've got good news tonight to share with you because you can look, feel, perform, and live younger with this historic breakthrough in stem cell activation. It's a new wearable technology in patch form. It's affordable, safe, non-invasive. It's drug-free. It's actually a patented form of phototherapy that uses very specific frequencies of light to improve stem cell activity. This is the brainchild of our visionary founder and CEO, David Schmidt, who's not only a brilliant scientist and researcher, he's a genius inventor with over 100 patents and patent pendings. And he's been on the leading edge of phototherapy research and science for over 20 years. He's already conducted over 90 clinical studies proving the efficacy of LifeWave phototherapy, and many more studies are in the works. Now, LifeWave is a 17-year-old advanced technology company. It was founded back in 2004 based on an energy-enhancing technology that David Schmidt, our founder, developed for Navy SEALs to increase their strength, stamina, and performance without the use of drugs, stimulants, or caffeine. The technology was so effective, it's now used by world-class athletes around the world in almost every sport. We currently have corporate headquarters and laboratories and manufacturing in California, Utah, and Ireland. And we're already doing global distribution to over 75 countries from 14 global distribution centers. And the word is getting out. LifeWave patches are now used by professional and amateur athletes around the world in almost every sport. And chances are, if you look carefully at, some of the Olympians, recently in the last Olympics just coming to an end, you might see some little white patches here and there on their bodies. And the media has noticed also. So how does this amazing technology work? Well, as I said, it's based on a type of light therapy called photobiomodulation. LifeWave patches contain very specific combinations of organic materials and nanocrystals. And when these patches are applied or near our body, they're activated by our body heat, and then they begin to emit very specific wavelengths of light, which stimulate very targeted and very beneficial biochemical responses in our body. This is known as photobiomodulation. It's a mouthful, but it is the basis for our LifeWave phototherapy patches. Now, it's been a well-recognized and proven scientific principle that specific frequencies of light cause specific changes within our body. For example, when we go out in the sun, a very specific frequency of the light from the sun causes our body to make vitamin D. We do not get a vitamin D download from the sun, okay? And another frequency of light causes our body to make melanin, the chemical that gives us a suntan. Well, LifeWave's patented technology is based on the same rock-solid, well-recognized scientific principle. I'm happy to tell you that for the last 12 years, our focus has been in the field of anti-aging and beyond that into regenerative science. And in January of 2019, we released to the global market the LifeWave X39 stem cell activation patch. And this truly is a historic and affordable breakthrough in stem cell activation. Some are actually calling it the holy grail of anti-aging and restorative science. And we're doing what the multi-billion-dollar companies and big pharma has not yet been able to do, which is X39 activates a very specific copper peptide that activates our own stem cells. And at the same time, it also alters gene expression of thousands of our genes towards a younger and more vibrant you. So X39 certainly is a game changer, activating our stem cells. It's a true breakthrough. And our founder, David Schmidt, says, this is my greatest accomplishment yet. So yes, we have patents. Yes, we have clinical studies. And yes, we have field results that are actually proving X39 is actually turning back our biological clock, helping us to look, feel, perform, and live younger. And for us baby boomers, this is very exciting news. So that's my little introduction, Robin, and I'll turn it back over to you to introduce our special guest doctor tonight.
Well, thank you, Gregory. And I like that little change you made. I hope everyone noticed that. I did. We'll do a test afterward. That was great. Thank you, honey. Okay, this evening we have Dr. Stuart Freedenfeld, and he got his medical degree with honors back in 1975. And then in 1988, he started studying all kinds of other things like herbal medicine, nutritional therapy, homeopathy. He was working with these complementary forms of healing with his patients and really put together what was best for them. So he put hundreds and hundreds of hours into studying, traditional herbalism, Chinese herbalism, homeopathy, nutritional medicine, IV therapy. And today, he's really become an expert, and he teaches integrating these multiple forms of healing. And we are thrilled to have him with LifeWave. And he is one of our doctors on our rotation every Tuesday night. So we want to welcome Dr. Stuart Freedenfeld. Where are you, Doc? There he is. Hi.
Hi, Robin, Gregory, and everybody.
Nice to have you. And he's quite an athlete too. We're going to talk about that a little bit, probably. So as a doctor and a practitioner, what is it, Dr. Stuart, that got you really interested in taking a serious look and then starting to experience the benefits of X39?
Well, I was asked to look into the patches by a colleague, a physician that I've come to respect quite a lot. She was seeing really interesting results with her patients that she was using it with, and she asked me to give it a look. I am used to getting a lot of hype and hyperbole about various new treatments and new, zigs and zags. So I'm very skeptical, but in order to advance in life and to learn things, you need to be an open-minded skeptic. And with an open mind, I tried the X39 patches and were remarkably impressed. I have a very active lifestyle. I am very physically involved, both in sports and in my daily activities. And the X39 very rapidly cleared up some acute pain that I was having. Rapidly, within minutes. It was crazy. My stamina, my recovery time from pretty heavy exertions dramatically improved. I just, I feel better. My lovely Patricia has had some chronic challenges. She had a shoulder injury from a whitewater rafting accident that she still blames me for. But that aside, she was, for 3 years, she was suffering with that and was ready to have surgery done. We put a X39 patch on the area, also used an Eon patch at another time, and she just recovered. She is back playing tennis and feels great. It dramatically improved her stamina, where she more than doubled her exercise tolerance for biking and hiking. She's had a chronic neuropathy in her feet that's inhibited her ability to hike and get involved with a lot of stuff that she loves. And now she's back to doing everything. She says her neuropathy is 70% better. And I've heard that from a number of other people that I've shared the patches with neuropathies. They're just not immediately, but after I guess 5, 6, 7 months, she's just doing wonderful.
I love it. And we love healthy skeptics. They're my favorite, actually, because when a healthy skeptic converts, get out of the way.
People that come to me with the notion that, you'll have the magic formula for everything, and but when the skeptic comes in, I don't believe anything you're doing, and they have a life-changing experience. That's really it's fun, it's rewarding, but it also is very meaningful.
It is so rewarding. And, I say to people every day I wake up, I hear miracle stories. It's a wonderful way to live. And so, Gregory introduced the whole stem cell revolution. And, some people know about stem cells. Some people have heard about stem cells, but don't really know. Could you just give a really brief definition of what they are and what happens when we age and why they're so important to have more of them?
Sure. So think about it. We start as a stem cell. Sperm meets egg, and that fertilized egg is now the embryonic stem cell from which everything develops. It divides into 2, 4, 8, 16, 32, big ball of stem cells. And eventually some of those stem cells start to differentiate. They begin to change their gene expression a little bit. So some are moving now towards placenta parts. Another group is becoming baby parts. And some of the baby parts will differentiate into mesenchymal cells that become muscle and connective tissue and bone and ligaments. Others become hematopoietic stem cells that form red blood cells, white blood cells, platelets, and so on. And we get more and more specialized into all these different stem cells. And that is what makes up all of our various tissues. It also is what heals our tissues. So we maintain stem cells from our birth. They basically are burst out at conception or during development, and they spread out throughout the body, and they reside in various organs. So when you damage a tissue, the appropriate stem cell line begins to form new tissue. We don't form new muscles by the muscle cell dividing. That's not how we heal. We actually get new stem cells and produce a new line. That's how our skin and GI tract is completely replaced every 7 days by stem cells producing new cells and pushing the old ones out. So as we age, we lose the ability to do that healing, partly because we have fewer and fewer stem cells, but also because the stem cells that we do have become less and less active. The remarkable ability of X39 to provoke the undifferentiated stem cells, a stem cell that can go to all the different directions, and to activate the stem cells that are kind of in that semi-hibernating phase, makes it a really powerful tool. The fact that it can correct, I'm going to use the word, epigenetic changes in our genes is really remarkable. So our genes are like an encyclopedia of all the knowledge to make everything that we consist of. And as we specialize, a cell that becomes a muscle cell or a liver cell, it's like the book of this encyclopedia is open to different pages. All right. So sometimes we get toxic effects that will come in and stick to the genes and really just closes the gene up. It's like closing the pages of that encyclopedia and making them stuck shut. They can't be opened up anymore. So we lose a function. And things change with aging. We don't have the same hair color. We don't have the same development of collagen, and our skin becomes more wrinkled. We don't have the ability to have as much mitochondrial energy, so we don't have as much stamina. The ability of X39 to both stimulate the stem cells and to reverse those age and toxin related epigenetic changes in our genes is just a remarkable capability. Remarkable.
I know I mean, it is miraculous. And, we were in Colorado recently, and Gregory and I were there with several doctors, and we're talking about it's a whole new paradigm of how we hold the aging process. And I love the way, we start out as a stem cell, and then we need them over time, and they can regenerate those damaged cells, like you said, so beautifully. So let's talk a little bit about X39 now that we understand how important stem cells are and what happens when we age, and know that it doesn't need to happen anymore. So X39, what are some of the benefits people can expect, and how long does it take for people to have an experience of this product?
Yeah, that's really interesting. For me, I had a very dramatic, almost immediate effect. Yeah, there it is, that massive Band-Aid that does so.
It's about the size of a quarter.
If anybody showed me that and said, this is going to change your life, I would.
Yeah, right.
It's actually, if I was, it would have made the healthy skeptic really difficult. It is ludicrous. This little patch that doesn't even release anything. It just sheds light energy back into your body, which provokes signaling molecules. But so we talked about the gene changes, the stem cell changes. It also activates a lot of amino acid production. So we get branched chain amino acids that are important in wound healing. We get increased tryptophan that's important in mood, depression, anxiety, sleep benefits. It increases GABA, which helps. It's like a filter, or that when we're being overstimulated, it kind of like puts that down. It increases mitochondrial function, so we have more energy. It increases collagen production, so our skin begins to look healthier. It just does so many interesting things.
And it gets better over time, doesn't it?
It may not help us live longer, but it helps us really enjoy what we have.
That is so beautiful, because there's that term lifespan and health span, and it's not about how long we live, but the quality of our life can get better and better instead of go into that decline. So who should be using this? Who shouldn't be using this? Is there anything to be aware of?
So people that are alive should be using it.
I like that.
The other one's not so much. There's no downside to it. There's some concern that maybe it may have a detrimental effect in people who want immune suppression, because it's a boost your immune system. In other products I've used that do boost the immune system, I've had people on organ transplants or on medications and such. I've never had a problem. So it's a warning, and I don't change the warning. It's a caution. I don't know that there is convincing evidence that there really is a problem. So, anybody would benefit from it, because if you are 30 years old, you may not feel it. You feel great. But if you use it when you're 30 and 40 and 50, then maybe when you're 60 and 70, you'll feel like me.
Yeah, and I love that you're such a great embodiment and model of healthy aging, because you're playing soccer with the kids, aren't you?
I am, I'm going on 73 in a couple of months, and I still play competitive soccer with down 20-year-olds. We had a league game. We were in the finals tonight, and I had to leave at halftime to come to join you.
Darn.
Don't know how the game turned out yet. I'll have to find out.
Yeah.
But yeah, I work out in the gym a couple of hours, 3 days a week. I play soccer 2 days a week. I cut my grass. I got done with 2 hours of soccer on Sunday, cut the grass, and then took a kayak 2 miles upriver for relaxation.
I love it. You're full out enjoying life. And isn't that why we're here? So let's see what kind of questions we have from people. And if you have a question, please put it in the chat. And remember that we talk symptoms only, don't mention disease states. And we do have someone, Ray says she started using X39 about 2 weeks ago, wearing it 12 hours. And she started having leg and feet cramps within a couple of days. And she added some magnesium, but also added butcher's broom. Is there an explanation why this would happen? And she also started having some detox rashes. So she cut back to a few hours a day. So what would you recommend for her?
Well, I all my life have suffered very severely from muscle cramps. I've actually ripped muscles from the severity of the spasms. And there's a number of supplements that I use, including magnesium, to help with that. It may be that the X39 is increasing her muscle activity, her muscle viability, and so that she is using more muscles and getting to the point that she is exceeding the amount of magnesium, which acts as a block to muscle and nerve activation. So the magnesium calms the nerves and calms the muscles.
So should she decrease her use of X39? What should she do to move through this because it's only been a few weeks for her?
Magnesium, especially the taurate form, in my opinion, magnesium taurate.
I'm going to write that down. Okay.
Taurine is an amino acid that helps to move magnesium intracellular. It itself has a major effect on muscle function, also calming the muscles. I also used carnitine to help with the spasms, and most recently have added the energy enhancer patch because it increases mitochondrial function, beta oxidation, use of fat to burn for energy. It has just almost completely eliminated those horrible spasms that, even with everything I did after a game, I would always wake up in the middle of the night with horrible spasms. I no longer get those. The energy enhancer has been just mind-boggling.
I love it. Well, you and Dr. Walt, big fans, and the body needs energy for things to work. So if we can increase the energy flow, everything's going to work better.
Nothing works without energy. Everything is energy.
There you go. Well, thank you so much for that. Chris says that if you have someone with a compromised liver showing sensitivity to copper, I understand that they would not want to supplement copper, but can they still use X39 because it activates the copper peptide, or can they use any other patches?
So just because you have liver problems doesn't mean that you have a problem with copper. Copper is an essential mineral to our bodies. There are some people who don't excrete copper and they overaccumulate it. And part of the damage that occurs is a liver damage. But that's a pretty rare situation. When you're taking copper, it's probably a good idea to always support that with zinc. They are paired. So a 15-to-1 ratio is a good ratio. 15 milligrams of zinc to 1 milligram of copper.
Okay, great. So it's okay to use X39.
Yes.
Okay, that's the important thing. Wonderful. Thank you. Thank you. Okay, Roxana wants to know, are the patches safe to be used for a pregnant woman?
When it gets to pregnancy, like if you ask me, can you use broccoli? I don't know, Having said that, and having delivered over 500 babies in my medical career, I would have no problem with using X39 in my patient. I can't recommend it in this venue for anybody else. It's just when you're dealing with an unborn baby, you just are extremely cautious, and so personal and recommendations are two different things.
Okay, so it's a personal choice, and we know that the patches are safe. No one's ever been hurt, but we also know that none of our products are ever tested on pregnant women. So just like you said, Dr. Stewart, it is a personal choice. And I know some women that choose not to, and I know some women that choose to. A woman that works with us, she's pregnant, and sometimes pregnant women have lower back pain from carrying. And she walks in my office, she goes, ice wave, ice wave. And but it is a personal choice because there are no tests on pregnant women. So that's a personal decision. Okay, Michael would like to know, how many genes do we currently know that X39 resets?
4,000, over 4,000 in the study that I saw, out of our 16,000 genes, so about a quarter of them.
Great. Okay. And Wendy is saying that she's been using the patches for 2 years with great results. This last week has been severe debilitating nerve burn in the top left thigh, possibly from low back pain or SI joints. Have used Ice Wave and Energy and Eon, well, probably all of them, looking for a new recipe that will help the pain. And just so you know, Wendy was in a very severe car accident and had lots and lots of soft tissue damage and some TBI also. Yeah.
Okay, so to answer a question without more specifics is difficult, but there is an area on the lateral thigh, it's like an oval shape, that often gets injured from pelvic brim injury. There is a superficial nerve that goes over the pelvic brim right in the front. And if that gets pinched or damaged, you'll get an oval area of either numbness or burning pain. So if that's the situation, then the treatment might be to apply maybe an Eon patch or a glutathione patch, or even the X39 patch over that area in the pelvic brim. And you'll need a physician to help demonstrate where that is.
Okay, wonderful. Well, thank you so much for that. Rosetta wants to know, is it okay to use the patch if you have she's mentioning a disease state that I'm not going to mention, but it's from the pancreas, not properly regulating insulin. I know it's hard to not say it, but we're not supposed to. So
Yeah. So I think that these is it okay to use it? Absolutely. It will help with metabolic functions. I wouldn't consider it a curative treatment, but it as a supportive treatment. You know, with a lot of pancreatic related problems, there are
very good.
there are a lot of tissues that that are damaged and are susceptible to really severe problems, including cardiovascular problems, neural problems, ocular problems. So a patch that can help to stimulate stem cells should be very helpful in keeping the body as healthy as possible, along with all good nutrition and proper supplements.
Wonderful. Thank you so much. Well, this is a good one. Roxanne is saying, why are there two different colors for patches, brown and white?
So you know which one to put where. It has to do with energy flow. And most typically, the white will be applied on the right side. And I think they chose white because it rhymes with white and right. So white on right and the brown on the other side. There was a few patch that you know, two patch systems.
Okay, so yeah, and I've heard that the right side of our body has a positive polarity, and that's the white, and the tan a negative. And sometimes, yeah, I'm not going to go into more detail on that one. Okay, so any other final questions? I don't actually even see them. Oh my goodness, you guys. And Wendy says, this is an amazing evening. Thank you, thank you, thank you. And I'll say thank you too. Any other final comments? We are at the bottom of the hour, and I'm so grateful to have Dr. Stuart with us. It's always, I love learning from you. It's a gift to me and a gift to everyone here. And I want to thank everyone for joining us this evening. Let's see. Please come back and see us again soon, she says. Isn't that wonderful? Yeah, you've got a growing fan club, Dr. Stuart. That's great. So thank you so much for taking time from your game. That's a big deal. And this recording can be found in our liveyounger.youtube.com. We have a YouTube channel, and if you go to the playlist, it'll be under the Tuesday evening calls, and it'll be up tomorrow in the YouTube channel. And anybody can access that, and you can share it with anyone you like. So if you are a guest this evening, we want to thank you for being with us. I hope you found this enlightening and educational, and you got the information you're looking for. So please, get back to the person that invited you, and we invite you to get started. There is a guarantee with the patches. If you try them for 30 days and you're not happy, you get your money back, which is wonderful. We stand behind our product, and very few people ever return them. And you got to drink a lot of water. We forgot to talk about that tonight. Very important, right?
Right.
Yeah. Yeah. And Anne is saying you are a role model. Absolutely. Someone said, don't ever go to a doctor that's not healthier than you are, and you embody health. And that, it's beautiful. Sometimes we see medical professionals that don't look so healthy. So you're a wonderful embodiment of health and vitality, and we're grateful. So thank you everyone for joining us this evening, and we'll complete our call. And so Chris says he's 71, and you're making me want to measure up. There you go. You're inspiring him. That's what we want. That's what we want. Okay, everyone. Thanks so much. Bye-bye.
Vim and vigor.